Welcome to this introduction to a new Upledger 4-day class called Beyond the Cranial Base. In this class, both your left and right brain will take action as wisdom and knowledge will go hand in hand. In the Beyond the Cranial Base class, you will get an organized view of the essential structures of the cranial base. You will learn the whole body relation to the different structures in the cranial base, and you will treat all of them by facilitating the self-healing capacity of the body. This class will take your knowledge, palpation, treatment skills, and the whole body perspective of the cranial base to a whole new level. My name is Thomas Lappi Rosenkilde Rasmussen, and I'm the developer of the Beyond the Cranial Base class. In my daily life, I run a clinic for mental medicine in Copenhagen, Denmark. I'm also an international teacher and the director of research for the Upledger Institute International. Now, the Upledger paradigm tells us that the body, mind, spirit is self-healing, and this capacity is part of our own inner wisdom. In this class, the self-healing capacity and the inner wisdom is central to all that we do. We will throughout the class practice to become and touch the wisdom of the paradigm. Here I'll just give a brief introduction to the knowledge part of this class. And I've tried to, in the beginning here, we'll give a focus on how I have looked at embryology to find a more simple way to understand the cranial base in a whole body's perspective. The whole body fascial system is organized into 4 parts, as seen in this figure. There's a superficial fascia layer, here shown by the thin black line, goes all the way around. Then we have the green with the head and tail, that is the central nervous system fascia, and then we have the purple in here, that is the visual fascia. In between here, these layers, we have the musculoskeletal fascia. So from embryology, we can see the whole body relation of the different fascial systems. Now let's take that into the cranial base. So looking at the cranial base and its fascia attachments from the outside, we can see again that the superficial fascia is now here shown at this edge. There's 2 muscles, an outer fascial layer. Then the axial fascia, the musculoskeletal fascia, is divided into a posterior, and here in the cranial base, this green area is the posterior group. It also has an anterior group of muscles that lies here, and this relates to all the muscles that are anterior to the spine in the body. If we look at the visual fascia, we also have 2 here. We have this red circle is the carotid sheet of visual fascia, and the black here is called the pharyngobasilar fascia. Here we have something very well known to us. It's the dual tube, and it's the meningeal fascia, central nervous system fascia. So you will have a map that allows you to navigate in the cranial base, understanding and being able to palpate the cranial base fascial systems gives a possibility to diagnose and treat complex whole body restriction patterns both locally and globally. You can learn the treatment of the fascial systems quickly and ready to use in your clinic right after this class. If we take a step deeper into this posterior musculoskeletal fascia, we find the myofascial bridges. Myofascial bridges are fascial structures that connect the deep cervical muscles with the dura here. And this takes place between occiput and atlas, and between atlas and axis. We can also see here we have the different types of deep neck muscles, and there are different fascial bands, the myofascial bridges, that connect directly into the dura. Tension in the myofascial bridges can create a multitude of symptoms and can be highly sensitive. You will learn to treat the myofascial bridges connected to the dura gently and globally, often releasing symptoms and restriction patterns on a very deep level. So in this class, you will learn to treat complex tension patterns in the cranial base, something that is central to treating whiplash. But from what you learn in this class, you will bring something with you that you can use in every treatment in your clinic. It is 4 days adding wisdom, knowledge, and a lot of hands-on time so that you will experience it all in your hands and in your body. I've added some testimonials from UI teachers, organizers, and students at the end, so have a look if you're interested. I hope to see you in the coming Zoom meetings talking more about the Beyond the Cranial Base, and I hope to see you in the future. Bye for now.